Good day, everybody, and welcome to yet another discussion. Today in conversation, we have Bisa Dobson with us, and she's a special guest, and she's with us on a special occasion in a special month, March being celebrated as the Lymphedema Awareness Month. And if that sounds odd to you and you don't know what it is all about, then you're absolutely in the right place, because that's the whole point of the Awareness Month. But before we get to lymphedema, let's talk a little bit about Bisa. So Bisa, welcome to the show. And why don't you start by introducing yourself to our audience, and then we can get into the conversation.
All right. Thank you so much, first of all, for having me here. I'm so happy to be able to share about myself and lymphedema this month. My name is Bisa Dobson, and I am a registered massage therapist and also what's known as a combined decongestive therapist here in Canada, where I live. And that means I'm certified to treat lymphedema, which is a condition that affects millions of people around the world. Not enough people know about it, which is why I'm here. My practice has been around for about 6 years, but I've been a therapist for 22. Oh my goodness, time flies. And I'm super passionate about the work and helping people. And when I'm not doing this, I am busy promoting my passion project, which is the shirt I'm wearing, a platform called Conversationally Thriving with Lymphedema to spread more awareness, education, and support for lymphedema patients. So this is my passion 100%. And I'm so glad to share with you guys today.
That's awesome. And you've been in it for a lifetime. And despite millions of people being affected, as you mentioned, the awareness levels are pretty low. And I must confess that it was the first time when I spoke to you that I really heard, what this is all about. And I thought, yes, absolutely, on our platform, we must spread the word. And as I mentioned, March is celebrated as the awareness month for lymphedema. So can you tell us, maybe in layman words, what exactly is this disease and how does it affect people?
Okay, so lymphedema, so it's two parts: lymph for your lymphatic system and edema, which means swelling or inflammation. So that is when your lymphatic system is compromised or damaged and you end up with swelling in the body's tissues because the fluid has nowhere to go because vessels are damaged or the system doesn't work well. So basically it's fluid stuck in the body with nowhere to go that causes swelling that can be painful and cause mobility issues for patients.
Okay, so edema essentially means swelling, and this is swelling, but it is particularly because of the disorder or the malfunctioning of the lymphatic system.
Yes.
Okay.
So I don't know how much people know about the lymphatic system, so let me just give you a quick overview. It's a really key, and very important circulatory system that works very closely, integrally with your cardiovascular system. So everybody knows about blood vessels, very little about lymphatic vessels, but they run side by side because they work together. So the lymphatic system, most people know it for its immune system function, which is super important, but it's also key in the absorption of fats in the digestive tract, removal of cellular waste, and in the context of lymphedema, especially for fluid balance in the body. If your lymphatic system is off, your fluid balance is off, and then you end up with the swelling that I discussed before.
Right. And many times we observe swelling. So how likely is it that it is because of this cause and not because of something else?
There are lots of conditions that cause swelling. So if you get an injury, you're going to have swelling because the body's inflammatory process wants you to slow down and take care of yourself. That happens. And deep vein thrombosis can cause swelling. All kinds. There's so many things I can't even list all of them. But if you are from a family that has something called venous insufficiency, that's when you tend to get heavy legs, we'll call it, and feel heaviness in the legs and swelling in summer heat, that kind of thing. If you have that running in your family, you're more at risk than other people. Doesn't mean you're going to get it, but you're more at risk. But that, again, is a separate condition from lymphedema, right? So there are lots of things that can cause swelling. But let me talk about what causes lymphedema, then maybe that's more clear. There are two types of lymphedema, primary and secondary. In primary cases, you're born with something in your lymphatic system that wasn't formed well. Okay, so it's a malformation in the system, and the swelling can start at birth, it can be seen, and anywhere up until the day you die. That could be triggered by something, right? So sometimes doctors will say a primary case is idiopathic just because they can't find the reason, but chances are there's some congenital defect or problem that wasn't noticed until you had. Secondary cases are much more common, and that is because of trauma to the system. So burn victims who have extensive burns often get lymphedema. Any major accidents that damages your vessel system, the vascular or the lymphatics. And in tropical regions, there is a parasite called filariasis. I always have to struggle to say that. So filariasis, and that infects mosquitoes. And if mosquitoes bite people in those areas, that parasite occupies, takes up space in the lymph nodes, and people end up with symptoms like elephantitis. So that's when you see elephantitis is another form of lymphedema, and that's because of an infection. And there are medications you can take to address that. And then the most common way in a North American, Western world context, so developed world, is through cancer treatment. Because cancer treatment still remains so brutal and invasive on the system, surgeries take away nodes and vessels, radiation then goes in and burns away more tissues. The risk factor for people who have that kind of treatment was way up, with breast cancer patients being the most affected. So in context in here in Canada, and I think most of the world, most often people know lymphedema because of breast cancer patients. And the very last one I'll mention that is a growing problem because I think worldwide obesity, morbid obesity, is becoming a problem because people's diets are changing. When you are morbidly obese, what happens is there's pressure on your vascular system, your blood vessels, and that pressure and problems start to seep into the lymph vessels because, again, they work very closely. So people who are morbidly obese also tend to develop lymphedema or can develop lymphedema as well. So those are the main causes.
So it's quite a wide spread. The first one which you mentioned is the primary, which I presume would be things that run in the family. And the second one, of course, the secondary one. There again, there are a wide variety of causes. But as I can kind of make out as a layman, even when it happens because of cancer treatment, essentially because of the radiation and the brutality with which you treat the cancer cells, the good cells or the lymphatic system or the vessels of the body also get affected and injured, which to the body probably is the same thing as suffering a burn or any external injury.
So anything that causes trauma, hurt, injury to your system in a major way and damages vessels in your body could lead to lymphedema.
Okay. And then I'm presuming also the reason why the awareness level is so low is because this is normally preceded by a trauma. The attention is on the trauma itself and the attention is not on the secondary impact. In the minds of the patients and their families, probably the villain is still, that cancer or that trauma or that burn injury or whatever.
Yeah, and a diagnosis of exclusion because, like I said, so many things cause swelling, like CPOD, congestive heart failure, can lead to swelling because, again, the heart and the fluid balance are connected. There's so many things. So you have to eliminate all those things before you make a diagnosis of lymphedema. So it's really hard to get a diagnosis. I myself have lymphedema, which is why I got interested. Another part of the story. But what I'll tell you, my journey is not atypical. I ignored it for a long time because I didn't want to deal with it. I have mild symptoms. But I finally got diagnosed 10 years later, and I got great treatment, which is why I decided to become a therapist. I saw the need in the community because other people, it takes years. Sometimes they're never diagnosed because for sure in North America, I think it's better in Europe, but internationally, I think doctors are not getting enough education about lymphedema, so they often miss it. Even I've worked with cancer care hospitals here in Toronto, and people come with lymphedema here to me, and they still haven't been diagnosed by the doctors because the cancer doctors, their job is to keep you alive. They're not worried so much about the rehab. I want you to live, and everybody else can deal with the other stuff. So often people come to me as cancer patients with the beginnings of lymphedema. I have to send them back to the doctor to get a diagnosis. So it is often missed. So if you think you might be affected somehow because you've had cancer treatment or you're seeing swelling, you don't understand what's happening, know that you're going to have to advocate for yourself a lot because, again, it's often missed by doctors and not getting enough education. I think that is changing slowly, but it is still a problem. So not only patients, but also healthcare practitioners miss it quite a bit.
Right. And by healthcare practitioners, you're talking about both the qualified medical practitioners and doctors as well as the nursing and the caring staff.
Yes. Absolutely.
Okay.
Absolutely.
Okay. That's in fact quite shocking, especially when you mentioned that the state of awareness amongst the medical fraternity itself is lower in North America than, say, in Europe. And I shudder to think, what it would be in other parts of the world. Probably, that's why they have a Lymphedema Awareness Month. And the idea is not just to spread awareness amongst the common people, but also amongst the medical fraternity. In fact, as a side note, I'm not sure, how much of it was in humor and how much of it was real. But when the black fungus happened as a result of the pandemic, there were, messages floating around that the black fungus was, as a disease, was not so important as part of the medical syllabus. And it was just one paragraph in an ocean of textbooks, and the medical students didn't give it too much attention. And when black fungus became such a big problem, especially, in some parts of the world, especially in India, people didn't know what to deal with it because they never studied for it.
Exactly. And as a person who walks around a brown body like you, I'm very aware of the fact that up until recently, there wasn't even a textbook that taught doctors what conditions look like on brown skin. They only had white skin. So lots of us who are not, the global majority is left out of that conversation, right? And the textbook was produced by a medical student in the UK who's black, who's like, you need to know what it looks like on brown skin so you can identify these things. So there's so many bits of information missing from medical education, and that is improving, thankfully. But know as a patient, if you have something that's rare or not often seen, you're going to have to advocate for yourself. I can't say that enough.
Yeah. So, given that you spoke of a wide variety of things and you spoke about, the difficulty in diagnosing things, it takes, several years, and you yourself took a lot of time. How is it that this diagnosis can be done, say, by a layman or, an ordinary person? So is swelling the red flag, and, what should one do when they observe swelling, for instance?
So if you have swelling that is persistent and doesn't go away, you need to go see a doctor. So let's say you have swelling after injury that could last for 2 to 3 weeks, depending on how extensive the injury is. If it goes on beyond that, you need to speak to your doctor and ask for some testing to make sure you figure out what it is. I don't think lay people can diagnose lymphedema. Not well anyway. I think that's something you need to go to a doctor to see, and then know that you're going to have to advocate. In city centers, teaching hospitals, I think internationally now there's more understanding of this condition, especially since cancer is on the rise, unfortunately. I think because it's an offshoot of cancer and in the rehab space for cancer, more people are learning about it. So in addition to the diagnosis due to exclusion of other conditions, there's now something called, let me not say this right, lymphoscintigraphy. So they can actually put dye in your vessels to see where there's damage, and that would work particularly well for people who have undergone cancer treatment because they know exactly where to put it. Or people who are primary and may have swelling in their foot, arm, or leg, for example, it might be a little harder to discern, but that now is something that's possible if you're in a bigger city and there are facilities that do that. So there are ways to get it done quickly if you're working with a knowledgeable healthcare professional. But to do it as a lay person, it would be hard. That being said, if there is family history of the heavy legs, like I spoke about, or anything that is around swelling, you might be like, okay, let me talk to my doctor about that and see if they can start to look and see if your family maybe is a primary case. A primary case is.
So apart from this diagnostic test, which is, I would presume, rather new, where you inject a dye and, through tracing the dye and the patterns, you kind of figure out what's going on. Apart from that, are there other old conventional diagnostic tests, or is it diagnosed more on the basis of experience and the patient history?
Patient history, but also so for example, I had a patient who came here a few months ago and needed to be diagnosed. She's going more traditional route. She's not getting the lymphoscintigraphy. So her doctor has to send her for all kinds of tests, like probably 12 different tests. Once all those tests are done, and I can't list them, sorry, my brain doesn't hold that much space.
Right.
Then based on that, they'll say, okay, this is actually lymphedema. So
it's a principle of experience as well as exclusion. So they'll do all the tests to exclude all other possible factors. We've spoken a lot about the diagnosis, but in terms of cure or prevention, of course, prevention I understand might be difficult because it is triggered by a lot of different things. But are there any preventive measures, or what's the line of treatment? What's the cure for this?
Okay, so there's no cure for lymphedema. Period.
Okay.
Zero cure. I would say in the context of cancer care, there's prevention. So people can negotiate with the doctors. And again, the doctor's job is to keep you alive. I don't want anybody fighting with the doctors, but you can say, do I need 20 nodes taken out versus 5? 3 are the biggest risks when you're going through cancer care for lymphedema. So if you can avoid having the radiation after surgery, that's wonderful. That reduces your risk. If you can avoid the radiation, try and limit the amount. And for the surgery piece, to reduce your risk, we want to take out less lymph nodes. So all these things are things you can do to prevent. Once you move into the treatment space, self-management is key. So I'm a therapist. I see patients here. I do manual lymph drainage to help them reduce the swelling. Then I teach them about compression therapy or apply compression therapy with compression bandages, help them get into garments because you have to wear a compression garment to maintain the size of your swelling. If you don't wear something to a garment, you will end up just getting bigger over time because more fluid fills the space. And self-management is key. So most people can't afford to come here every day. I'm out within 24 hours a day. So doing your own self-massage, lymphatic massage, wearing the garment daily, eating well, exercising with moderation, because again, you don't want to push yourself into flare, and resting when you need to, doing all these things, pacing yourself, doing lots of self-care, all these things help with self-management. But again, there's no cure. I want to be really clear about there's no cure for lymphedema. And then also that is moving into the non-experimental space. It's still slightly experimental, but now happening more often. People are having lymphatic surgeries. So If you've had cancer treatment and ended up with lymphedema, they can do something called a lymphovenous bypass, where they have a healthy lymph vessel in the space attached to a vein, so that the fluid is drained out of the area. There are also lymph node transfers, which are less common, where they actually take lymph nodes, usually from your mesentery or stomach area, because there are lots, and place in the area that's affected. Less common, and they used to only do it on people who had extreme cases of lymphedema. Now it's advanced to the point where if you're having surgery, let's say breast cancer surgery, the breast cancer surgery can do his work, and then the surgeon to the lymphatic bypass is right there afterwards. So then they avoid getting lymphedema entirely. So again, not a cure, but a way to make sure less people get it and that they're doing better once they have it.
Okay. So especially in the context of cancer patients, that at least you could plan better and you could optimize, I would say,
Yes.
the probability of pulling through and destroying the cancer vessels. So
Yes.
is it a standard practice that lymphedema practitioners, just like any other practitioners, whether they are cardiovascular or kidney or other specialists, do they kind of work hand in hand while these things, the chemotherapy and the radiation, etc., are being planned, or we still need to kind of evolve to that level where lymphedema gets its voice in the cancer treatment?
I think that, again, I live in a city with great hospitals. There's a teaching hospitals in the downtown area. So that's happening more here. Absolutely. So there's more chance of a woman going in for breast cancer treatment, she can talk to her oncology surgeon and say, can I have these two things together? Much more likely. I'm sure in places that don't have teaching hospitals where this kind of work is being done, it may happen a lot less. But definitely there is conversation about lymphedema in the cancer spaces. I think sometimes the luck of the draw and the doctor, you get how much they know, but definitely those conversations are happening, especially if you're in a big city center, I would imagine, for sure.
Right. Yeah, but it's not a standard practice across the whole of North America, or certainly
not yet, and I don't think even in Europe yet. But I think it's, or other places. But I think it's still, surgeries are still quote unquote experimental, but it's advancing, and hopefully in the next 5-10 years it will be normal. Absolutely.
Right. Yeah, we've spoken about the medical side a bit. Looking at it from the lens of a patient or somebody who's suffering through these disease, what are the challenges they face, and what is it that they have to go through?
I'll talk about cancer patients. That's mostly what I deal with. Let's start with that. So for cancer patients, after you've been through the surgery and the chemo and all the things, the number one thing I hear people talk about, like, I didn't know I was going to be quote unquote disabled and have this as well, right? So cancer is really harrowing treatment. You come out, you think you're done, like, yay, I've seen the light. And no, you have all these things to deal with, including, for some people, lymphedema. So it's really a big challenge to adjust to the new normal. Wearing a garment, they're compressive, they're tight, people think they're unfashionable. It's like a real mind shift to be able to do this every day and get used to it. And adjusting your routine, like you brush your teeth every day, you've been doing that since you're 2-3 years old, super normal. Now to have to do massage and put on a garment and worry about people asking questions about it, which is hard for some people, it can be really, really tough and a bit of a journey mentally and for people and physically for people to get used to that. So the challenge is to get used to all the things you have to do to manage your life and live well. And people absolutely can live well with lymphedema. I want to say that as well. But it can be a challenge to get used to doing all those things you need to do to thrive and live well. Absolutely, 100% for cancer patients. For kids and young people who get lymphedema, especially at a time when you want to be just like everybody else, standing out and being different can be super emotional and really hard. And a lot of people do hide because of it. There's a beautiful online community that I'm part of now, and you see more kids coming out because adults are showing themselves and showing their garments. And so there's a movement to do that. But yes, I think whenever you feel different, it can be emotionally hard, and that's definitely a journey for anyone who has a condition or anything related. Yeah.
So, as you mentioned, it's probably because they have, at least in the first case when you were talking about the cancer patients, since they're dealing with a much bigger enemy, once they've kind of conquered it or defeated it, they expect things to get back to normal, but they don't. And I believe the expectation reality mismatch is essentially what probably causes even more trauma than the physicality of the disease itself.
Yes. Cancer is a really tough journey. Anybody who's been through it knows, or even has a family member, and to wake up on the other side and know I have brain fog, cognitive issues, sexual health issues, my nutrition's off, and I'm not getting the nutrients I need, like musculoskeletal stuff, and then on top of all that, lymphedema, right? Mm-hmm. It's a lot for people to deal with.
Right. So, apart from the cognitive and the, the psychological things, what are some of the other kind of lifestyle changes that one needs to make in order to deal with the lymphedema, in order to manage it?
So I think the key piece around that is like finding balance, which often means for people who are doers, especially slowing down, right? So I spoke before about the fact you have to exercise, but not too much. So getting back to that, when you are starting new activity as a person with lymphedema, whether it's spring cleaning in your house or deciding to go for a jog, depending on what body part is affected, you have to pace yourself, right? Because what happens is we're always making lymph fluid, which flows through the lymphatic system. When you move more fluid is made. When you move less fluid is made. So as a person who, let's say I had breast cancer surgery and this side is compromised and now I have lymphedema, if I decide to get up off the couch and then do 3 hours of cleaning, there's a chance I can push my body to flare because it can't handle the fluid that is being built up because of the damage here. So you have to pace yourself and work incrementally. So whether we're talking about vacuuming the house on a Saturday afternoon or going for a walk, pace yourself. So you may only do half an hour or 15 minutes, stop, see how I feel the next day. If my arm responded or my leg responded badly, then I know I have to pull it back. If I did okay, then I can increase maybe 5 more minutes and slowly build up. So there are people who have lymphedema who are CrossFit champions, mountain bikers, aerobics instructors, all these things, but they had to work up to it incrementally to make sure they can manage their symptoms and not push themselves into flare and make it worse.
Okay. So yeah, essentially slow down and kind of reduce the opportunity set for it to cause havoc and create.
And if you want to do activity, just know that you absolutely can, but you have to take it incrementally. You can't just get off the couch and run that marathon.
Right. Yeah, absolutely. I think there's also a trend, particularly because of, social media and the fear of missing out, that people want to project a very different, socially, physically active image of themselves. And inadvertently, they're probably doing, at least in some cases, doing more harm to themselves than good. So balance, absolutely.
Balance.
So balance is the key.
Slow progression, very important with lymphedema. Yeah.
Right. So, we've spoken about, the medical fraternity and the patients. Switching lens again to look at it from your perspective, what brought you into this field and how's your experience been managing lymphedema patients and being in this line for about a couple of decades?
So I got into this field because I mentioned before, I have lymphedema. It developed for me when I was about 25. I was playing baseball and I twisted my ankle and the swelling, like I said, wouldn't go away. Like weeks later, my mom was like, you need to go to the hospital. So I went and was basically told by many a surgeon and doctor, it's swelling, just you'll have to deal with it. Don't worry about it. And my concern as a 25-year-old woman was like, I can't wear cute shoes anymore. Oh my goodness. And because I didn't want to deal with it, I ignored it for a long time. And I don't know what finally got me to go to the doctor, but I finally figured out how to diagnose this. And because I'm a therapist, I know other therapists, I was able to find a really good lymphedema therapist quickly. And she got me set up with my treatment and taught me the self-management. And I went to a garment fitter who was also great. And when I spun around and met other people who had lymphedema, their stories were way more difficult and challenging than mine as far as diagnosis and treatment. It's like, okay, there's space for me as a registered massage therapist to now become a lymphedema therapist. So to be very clear, I've been a registered massage therapist for 22 years, a lymphedema therapist for about 10. And so that's my journey. I love this work because I get to give back to a community I really care about. And also I get to help people who are feeling, I tell people my work is happy work because it's like, how can you work in cancer? And I love it because whether somebody comes in bedraggled or with a smile on their face, they leave with even a better smile or less bedraggled when they came in. I always leave people leaving better and happier than when they came in. And that is joy upon joy for me. So I love this work.
Okay. Yeah. So I was kind of about to ask you that, what makes you tick in this field and, what are some of the attributes that one needs to be successful in, I think, the broader category of being a caregiver. I would kind of club all the caregiving professions into this. So one of the things, obviously, you mentioned is empathy for others and the joy, the vicarious joy that you get by seeing relief on others' faces and seeing the smile on other faces. Apart from that, what else do you think makes caregivers tick, and for what kind of people are these professions good, and who are the kind of people who should get into professions such as these? Because as you mentioned, some of them say that dealing with cancer patients, how can you be happy and, how can it give you joy?
I think everybody has to find their own lane, right? So I have a friend who does emergency dispatch. I could never do that. She loves that work, right? She hears the most harrowing things. Find your lane. So my lane is cancer care. I can do this. I'm lymphedema. And I just think you have to really be passionate about helping people, or at least enjoy it. You have to like being around people for sure, because it's not always fun. And, they come with different moods. So you have to generally like people. And I think you have to also be prepared. People too often, I don't think I feel this so much, but I also think that my practice has attracted people who enjoy my energy and my space, right? I think that this work is too personal not to have it that way. But I think you have to be prepared to work with people you don't like and treat them the same way you treat people you do. And you have to be prepared to have challenging moments and work through it anyway, because the greater good for the person is the key thing in your mind. And I think most healthcare practitioners, that's how they think, right? That they want to help people and make sure they do well and do better, do no harm, as it were. So I think if you're into helping people and you like people, and you pick a lane where the physical and energetic impact on your body is something you can manage, I think you'll be fine.
Absolutely. And I know of a few people, who have that desire to, and, urge to help others, and they get and derive joy from that. But when it comes to seeing, the misery and seeing other people in pain, it kind of starts affecting them personally. Did you also face those sort of challenges, and how did you overcome them?
I don't think I face this challenge in this work because it works for me. Like this, I love this work. So, but I know when I was younger, I thought I'm going to work with teens, and I tried to do that, and I was like, not for me. Well, you have to find what works for you and your personality, right? And I think that's key. And if you're in a space right now where it feels off, maybe you should shift and find another population. That's what I would say. That's what I did. So I thought I want to work with teens. I love that. No, I don't. I do not.
Yeah.
So, and I think also self-care is super important, right? So you need to do things when you're off work that nourish your spirit and your soul and take care of you as well to make sure you're having balance.
Yeah. That couldn't be more important than in the caregiving profession. If you're not taking care of yourself, then beyond a point, you won't be able to take care of others as well.
Absolutely.
Yeah. Okay, that's wonderful. So thanks a lot, Bisa, for kind of running us through 360-degree view of lymphedema from the perspective of, the patients, the medical fraternity, the kind of line of treatment, as a healthcare or a, caregiving professional in this space. Anything else you would like to add? Because I know you have multiple interests and you are into a lot of things. We don't have time for too many of those. We've focused on lymphedema since it's the Lymphedema Awareness Month.
I want to keep the interest on that because that's what I want to focus on because this is important to me. So I want you to know, because I didn't get a chance to say it before, over 250 million people worldwide are affected by lymphedema, and not enough people know about it. So if you have any questions and concerns, please feel free to reach out to me on social media. I'm happy to answer any questions people have, help them find resources to get help because I think it's so important. The platform I have with my friend Deborah, who is a breast cancer survivor and patient advocate, is Conversationally Thriving with Lymphedema, and it's conversation then LY to find us. There's on my t-shirt. And it's about education, support, and community. So if you want to learn, if you need support because you have it, if you're looking for community because you're somebody who has it or know somebody who needs it, please reach out to us. We're here to help, and I just want to spread the word. So that's all I want to say about that.
Okay, that's awesome, and thanks a lot for all the generous offer to support and to help. We'll put the extracts of our discussion into a post on our website. And the couple of links that you mentioned, we will embed those as well. So the viewers can find the links to the post in the comments as well as in the description on YouTube. Hopefully it will help spread the awareness and people will not at least go undiagnosed and suffer because of this condition. So with that, thank you so much, Bisa, for sparing your valuable time and helping spread the word.
And thank you so much for having me. I really appreciate it.
All right. Thank you.